Medicare is complicated. Medicare can be confusing. Medicare is no fun to study. Will you know what decisions to make when Medicare time arrives for you? My name is Doug Jones, and I wrote a book to help you figure it all out. Medicare for the Lazy Man. It's on sale at Amazon and BarnesandNoble.com. Also, you can download and listen to my podcast, Medicare for the Lazy Man, wherever fine podcasts are given away free of charge. Medicare for the Lazy Man, simplest and easiest guide ever.
Like 40 miles of bad road, it's the Medicare for the Lazy Man podcast. The Medicare podcast that blushes with embarrassment. And now he might have joined Toastmasters if he weren't so bashful, Medicare expert Doug Jones.
Well, hello, everybody. Welcome to another exciting episode of the Medicare for the Lazy Man podcast. My Canadian nephew, Drew McMillan, probably told you who I am. I am Doug Jones, your Medicare expert for today, and I'm so happy that you've joined us. It's a tough row to hoe sometimes, this Medicare stuff, especially when you're approaching Medicare and you don't really know what to do or how to do it without making mistakes, without perhaps becoming confused and confusing those around you. But I have a solution for that. And the solution lies in my book, Medicare for the Lazy Man 2023. If you go to BarnesandNoble.com or Amazon.com, go to Medicare for the Lazy Man 2023 and decide which of the many editions you're going to purchase and plunk your money down. I think you're going to find the solution to any of your problems having to do with Medicare. There's a path that you can follow that will depend a little bit on your personal situation. Are you actively at work in a company and plan to continue that? Are you just turning 65? Any number of situations you could find yourself in. But once you know what your particular situation is, you can actually use that book as a guide. It's almost like a roadmap, and you can find your way through to the Medicare land of milk and honey, and you'll be a happy camper for as long as you're on Medicare, which, just between you and me, is going to be the rest of your life. However, I think it's going to be worthwhile for you to learn how to do that Medicare thing in advance of your actual encounter. So if I were you, I would go to Barnes & Noble or Amazon.com and purchase Medicare for the Lazy Man 2023. Take that sucker home and, have a gander at it. It won't take you very long to go through, and you'll understand more about Medicare than you ever thought possible. So that's my advice for you. Now, I've got some advice for a guy named Randy Carson, and that would be stay away from dentists. Randy has told me, stay away from Illinois, too. It's snowing out there. I had to show Randy on my Zoom screen the fact that it's Halloween and it's snowing in Illinois, which is completely ridiculous. But then he regaled me with his latest trip to the dentist. And frankly, I'll take the snow. Hello, Randy.
I was in that dentist chair so long, Doug, I began to think I had grown to it.
Well, I thought you had a birthday somewhere in there and you weren't around to celebrate it.
I think so. Yeah. I don't now. Obviously, somebody's probably going to break this record, but I was in the chair for 4.5 hours.
Well, that's completely insane. At least they ought to let you take a nap, maybe give you a meal, watch some television.
Yeah, something. I was so down and I was just so out of it when it came time to get up. I darn near couldn't walk.
Well, I can understand that too. Once I'm, flat on my back for 4.5 hours, it's difficult for me to change that position too. I'd rather, if I have to do something, people bring that task to me and,
Oh, yeah. Yeah, I totally get it.
Hey, I wanted to compliment you. Oh, you had a thought.
Go ahead, Doug. Go ahead.
You gave me an article that is going to be an excellent service for our listeners today. And I know it sounds like we're just beating up on the poor kid, and we're picking on the Medicare Advantage plans, but in this case,
we are definitely not picking on it.
Yeah, we're not being malicious about it. We're being
No,
factual.
we're
And
just we're stating the truth, Doug. That's all we're doing.
absolutely. And you have presented the truth in a multi-page format that is just very, very impressive. And I wanted to tackle that today, but you had a thought you expressed a minute ago. What was
You
that?
mind if I whine just a little bit more?
All right, do that, but then we'll get into this article.
Okay, well, this is whining about the cold weather.
Uh,
It has once again sunk into what Randy officially calls Arizona freezing.
a
And
couple of
my
days ago, everybody was
yeah,
telling me how great it was.
yeah, I kid you not. Now, this is going to be really hard for people to understand if you're not in this particular area, but you air up your tires so that they're at the appropriate temperature for a so that they're at the appropriate pressure for a particular air temperature.
Yeah, yeah,
The temperature, and so that's, in Arizona, that's significantly warmer than anywhere else. So,
sure.
overnight it dropped down to high 50s.
Oh, ouch.
We were like 57. So on the way to my miserable appointment at the dentist,
Uh-huh.
all my automatic air pressure indicators for my tires went orange because the air pressure
Boy.
had dropped so much in my tires.
Was this in your Jeep or were you driving some
No,
battery
that
powered
was
thing?
that was
No.
Margaret's Prius.
Just yell, shut up at it. It should
Yeah,
not be bothering
exactly.
you while you're driving.
Yeah, in the Jeep, we don't need no stupid air pressure sensors in a Jeep.
Absolutely not. That's too manly to have to worry about that. But
That's
I
right.
I understand the concern on if you air up your tires on a hot day and then it turns cold before you have to do it again. All of a sudden, that pressure reads differently to the sensors in there.
Oh gosh, yes. It's and it. I knew it. I knew I was in no real, danger of going flat, but it still bugs you. When you got
Yeah.
this
Oh yeah.
orange light on the dice going, there's something wrong here, buckwheat.
Well, I was driving Mary's Grand Cherokee on the way up here, and I ran over a big chunk of tire tread in the middle of, I think it was the Will Rogers Expressway or Will Rogers Turnpike in Oklahoma. And it did something to one of those sensors, and now it tells me that tire is flat every once in a while, and we have to push the clear button, and start it all
Oh
over
yeah,
again.
yeah.
So I
Well,
know
the
the
other,
irritation.
yeah, it just bugs you. And the other problem is, fortunately, that's all it did to your Jeep. Was this your
Yeah,
Jeep you were driving?
it was Mary's Grand Cherokee.
Okay, Mary's
It,
Grand Cherokee.
it's not
So
mine.
anyway,
It's got way too many doors on it to be mine.
oh yeah, that's right. You don't want to claim it, do you?
No,
Well, Margaret, she was driving down the freeway out here and hit a big chunk of tire that came off some 18-wheeler, and it busted the air spoiler off of the underside of her car.
Oh no,
So
jeez.
then we had to go to the repair shop and say, we need to get an air spoiler for this. And of course, back then you go, oh yeah, we'll put one of those on order. We'll let you know if you retire before we get it. We'll try to do it sooner.
Margaret's not lurking around anywhere where she can hear me, is she?
No,
May I ask you if that car actually goes fast enough to actually need an air spoiler, an air
no,
dam? Yeah, there
no,
you go.
no.
So
It's all for looks. That's all it is.
that's what I thought. No, it looks fast. It just can't go fast.
It looks fast. It doesn't go fast.
Oh boy. Well, listen, I want to do justice to this magnificent evidence, this piece of evidence that you dredged up and sent to me. And so it's lengthy and very meaty. And so I think I should get started on it right now so we don't have a 3-hour long episode. What do you think?
I think that's an excellent idea. I've got coffee. I've
All
got
righty.
muffins. I'm just going to sit here and listen to the story,
You
and
can
I
put
think it's gonna be a good story.
I think so too. If you can put your glasses on with the eyeballs painted on the lenses, and that way I won't know if you're taking a nap or not. But let me tear into this. Randy found this, and it is magnificent. It is telling people everything that I've been telling them. I wouldn't be doing my job if I didn't warn Medicare participants that to get a Medicare Advantage plan is to court disappointment. And this article makes it apparent that is exactly right. So it was in USA Today. printed last Friday, October 27th. The author is Ken Alltucker. And the headline, hospitals and doctors drop private Medicare plans over payment disputes. When they say private Medicare plans, they're not talking about Medicare supplements. They're talking about Medicare Advantage plans. And it is quite a disaster brewing, it sounds like to me. So let me dig into this and we'll see what you think. One large health system with hospitals in Virginia and Ohio this year cut off in-network access to consumers enrolled in some Anthem, Blue Cross, Blue Shield, Medicare, and Medicaid health insurance plans. Medicare Advantage plans they are. Anthem, Blue Cross, Blue Shield. Two doctors groups with Scripps Health in San Diego, now we talked about this particular situation, they're terminating contracts with private Medicare plans, Medicare Advantage plans that is, over concerns about payments and routine denials. For years, hospitals, doctors, and health insurance companies have squared off over how much to pay for medical services. Insurers negotiate contracts with hospitals and doctors so their customers can get lower in-network rates at those facilities. These negotiations, usually hammered out behind the scenes, are becoming increasingly tense and public as hospitals seek adequate payments and health insurance companies attempt to check spiraling medical bills. Experts say that these disputes could be an early warning sign of more contract terminations ahead as hospitals and large doctors groups seek lucrative payments to offset inflation, healthcare workers' double-digit raises, and escalating prices for medical supplies. But for patients caught in the middle of these disputes, the results can be devastating. Some need to switch doctors or insurance plans or potentially pay higher out-of-network rates at a time when half of all Americans are struggling to afford the rising cost of medical care. Scripps Health ended the 2024 Medicare Advantage plan contracts with two medical units called Scripps Clinic and Scripps Coastal. The decision will affect about 32,000 patients who will either need to switch Medicare plans or find new doctors. We're unfortunately on the vanguard of what I think is going to be a very ugly few years between hospitals and commercial insurance companies, said the president and CEO of Scripps Health. Hospitals target private Medicare plans is a headline for the next section. Many contract terminations involve hospitals rejecting terms for private Medicare insurance plans known as Medicare Advantage plans. While traditional government-run Medicare allows enrollees to choose from a wide variety of doctors and hospitals, that's Medicare plus Medicare supplements is where you have that freedom of choice, ladies and gentlemen. Private Medicare plans, these Medicare Advantage plans, restrict access through networks and impose some cost-sharing requirements such as co-payments or deductibles. Hospitals that are rejecting Medicare Advantage plans say that they don't reimburse at the same levels as traditional Medicare. They delay or deny care through prior authorizations, and they impose other limitations. The Scripps official said that the exit was a very difficult decision, but one that he had to make due to more than $75 million in annual losses. He tried to negotiate more lucrative reimbursement rates, but those talks fizzled. While private Medicare plans, that's Medicare Advantage, while Medicare Advantage plans are funded by government-run Medicare, they are also profitable because insurers can keep a portion of the payments before paying for care. This gentleman described private Medicare offerings, Medicare Advantage plans, as delay, deny, don't pay. They are in the business of making money, he said. Hospitals cut off insurers that don't reimburse us adequately. Doctors, groups, and hospitals are more willing to air frustrations over private Medicare plans, read Medicare Advantage plans, after think tanks and government watchdog agencies have issued critical reports about these insurers' profits and practices. In 2022, a government watchdog report said that private Medicare plans, Medicare Advantage, routinely rejected claims that should have been paid and denied services found to be medically necessary. These private plans rejected nearly 1 in 5 claims allowed under Medicare coverage rules, and they denied 13% of authorizations for medical services that government-run Medicare would have allowed. Doctors and hospitals are more willing to publicly express their frustration because these Medicare plans, these Medicare Advantage plans, get what many people would characterize as overpayments. More than a half a dozen other hospital systems, that's 6 other hospital systems, more than 6, from Bend, Oregon to Nashville, Tennessee, have announced private Medicare contract terminations or lapses. St. Charles Health System in Bend, Oregon said it will end Medicare contracts next year with Humana, HealthNet, and WellCare. The chief clinical officer at St. Charles Health System said sticking with those private Medicare plans would result in restrictions to patient care, longer hospital stays, and administrative burdens for doctors. As of mid-April, Vanderbilt hospitals, clinics, and doctors exited the networks of Humana's HMO Medicare plan and Kentucky Medicaid plan. The hospital advised patients to either shop for a new insurance plan or contact Humana to find an in-network provider. A Vanderbilt spokesman declined to answer questions about the lapsed contract, referring USA Today to the health provider's website on the dispute. On the website, Vanderbilt cited the need for fair partnerships to cover the higher costs for workers, supplies, equipment, and medications. We can't continue to partner with insurance plans that don't reimburse us adequately, Vanderbilt said. Earlier this year, Bon Secours contract with their contract dispute with Anthem Blue Cross Blue Shield put tens of thousands of Medicare beneficiaries in Virginia and Medicaid recipients in Ohio out of network. In a lawsuit filed in August, Bon Secours alleged Anthem owed the health provider $93 million in unpaid claims. Last month, Bon Secours dropped the lawsuit as the two sides settled the payment dispute and reinstated in-network access for enrollees. Despite these recent contract disputes, industry officials representing private Medicare plans, say Medicare Advantage plans, say they remain wildly popular with seniors. Now, here's what they say. More than half of eligible Americans chose private Medicare plans over traditional Medicare because they deliver better services, better access to care, and better value, said David Allen, a spokesman for America's Health Insurance Plans, an industry group representing insurers. Well, I'll tell you why that's a lie. Half of America's seniors, do not choose Medicare Advantage. A good chunk of those people are forced into Medicare Advantage plans because they've been promised retiree health insurance. And when the government has told employers that they will pay the freight for these Medicare Advantage participants, then the companies run to the table to sign up for Medicare Advantage and force their retirees into the Medicare Advantage plans. That's a big dispute in New York City. They have 250,000 retirees that they're forcing into a Medicare Advantage plan. Why? Because the city then will save something on the order of $600 million in premiums because the federal government, your tax money, will pay the freight for these Medicare Advantage victims that used to have the choice of regular insurance for their retiree health insurance. So that is a big lie that they're purporting or that they're putting over on people, that half of the retirees are choosing Medicare Advantage. Many of those people are forced into Medicare Advantage. This Allen person added that private Medicare plans, meaning Medicare Advantage plans, must maintain adequate networks of doctors and hospitals and notify customers when there are significant changes to those networks. Medicare Advantage includes robust protections for the people it serves. No, it doesn't. I run into people all the time who are perfectly willing to tell their scary stories about being in a Medicare Advantage plan and having treatment delayed or denied. Patients are caught in the middle, it goes on to say. As health providers such as Scripps help sever ties with some insurers, consumers are confronted with difficult decisions on how and where to get medical care. Some face the prospect of seeking out-of-network care that might cost more money. Seniors in the San Diego area who will be cut off from the two Scripps Health Doctors networks are scrambling to assess their options. People are really upset with Scripps. Seniors on Medicare have the option to choose a new plan during Medicare's annual open enrollment, which runs from October to December 7th. Seniors can choose traditional government-run Medicare or switch to a private Medicare Advantage plan, but some scenarios may catch enrollees off guard. Traditional Medicare charges 20% coinsurance for medical care with no maximum limit. People on Medicare can purchase a supplemental insurance plan called Medigap or Medicare Supplement, which largely covers those extra medical bills. However, people can only enroll in Medigap at certain times, such as when they turn 65 initially sign up for Medicare insurance. If they try to switch from a Medicare Advantage plan to traditional Medicare, they may not be able to purchase the supplemental insurance because Medicare supplement insurers can deny coverage for existing health conditions, such as diabetes or heart disease, or they can charge consumers more, although I really have not seen that happening. Only states such as New York and Connecticut that have guaranteed issue laws that allow seniors to sign up for a Medicare supplement plan year-round. That trips so many people up, this guy says. His name is Lipschultz. I have to stop my snickering every time I look at his name. So anyway, this insurance broker that they have interviewed has been working long days answering calls from Scripps Health patients who want to know what their options might be. Some are willing to keep their existing private Medicare plan, Medicare Advantage, and change the primary care doctors. Others want to switch Medicare insurers. Private Medicare plans, Medicare Advantage plans, must maintain an adequate network of providers. So if a hospital drops from an insurance plan's network, that can raise questions about whether the insurance plan has enough in-network providers for enrollees. If more hospitals and doctors drop Medicare Advantage plans, that further begs the question whether, in fact, the network is adequate. Medicare allows private insurers to set their own rates, while the Centers for Medicare and Medicaid Services oversees private Medicare plans, that's Medicare Advantage plans. The federal agency does not become involved in contract disputes. The federal agency is permitted or prohibited from interfering in contract disputes or dictating reimbursement rates that private Medicare plans negotiate with the health systems. CMS evaluates whether contract disputes that terminate in network coverage have the potential to affect a large number of Medicare Advantage enrollees. If these contract terminations result in significant network changes, the federal agency can order a special enrollment period to allow beneficiaries to switch plans. The agency said it did not have a number on how many such contract terminations or special enrollment periods are ordered each year. Some private consultants who advise hospitals and health systems on how to get higher reimbursement rates from private insurers advise them to terminate contracts as part of a negotiating tactic, even if consumers face higher bills and collection threats. The vice president on Ensemble Health Partners, which describes itself as a tech-driven revenue cycle management company. So they're going to talk to this gentleman now, who is the vice president of that Ensemble Health Partners. He said that terminating a contract is your last option when negotiating with private insurers. Hospitals are adopting harder negotiating tactics with private medical plans and Medicare plans because that's where insurers are making their money and refusing to work in good faith. We don't really put ourselves out as the bully on the block, he said. Sometimes you have to take a more aggressive approach as a means to that end. So this basically warns that not only are a bunch of hospitals and facilities, large medical facilities, stopping their allowing Medicare Advantage plans to pay the bills for their patients, but also apparently more of that is on the horizon, according to their predictions. And so I'm really happy that you brought that article to my attention, Randy. I would not have seen it on my own. but it's a scary thought for people who
Well,
don't have a lot of
I
options.
wouldn't have picked up on it if you hadn't have educated me over the years. I wouldn't have noticed that that's what it was all about either.
Yeah, that's not your typical reading material.
No,
There were no pictures.
No, there was no pictures. There was no Corvettes. There was no GTOs. There was nothing. But the thing that caught my attention, and still to this day, I always have to remind myself, is when they're talking about private Medicare plans, that's Medicare Scam Vantage.
It certainly is. It's Medicare crap vantage.
Yeah,
It's
crap. It's Medicrap. That's the name of it.
Yeah. Medicare we sell are also private plans put out by the same insurance companies in many cases, but what they refer to as private. See, the lefties that really hate Medicare Advantage are really angry that Medicare Advantage plans are privately owned. Well, Medicare supplements are privately owned, and that's what I proudly sell. And I do not sell any Medicare Advantage plans.
Yep. No, I totally would have not picked that up if it hadn't have been for the education you have injected into my little brain
Well,
about this stuff.
I'm happy to broaden your horizons. Hey, it just occurred to me.
Yeah,
go ahead. Go ahead. Well, I was just going to say we're actually finished a little early today. I could go out and shovel some snow.
Well, yeah, or you could get in the car and come back home.
That's my plan, buddy. 2 more days and then we're out of here. I've been promised. Now I've been lied to before, but I'm hoping against hope that this is true this time.
Yeah, I get it. So anyway, we have used up our 75 cents.
Yep.
Time's up. We got to land the plane, bring the bus into the station right behind the train. So anyway, but there's always a few things I want to kind of clean up. It's always kind of my wrap up. If you want to reach out to Doug, get yourself a pencil. You can reach him at dbj@mlmmailbag.com. That's dbj@mlmmailbag.com. Don't forget, Doug is licensed nationwide in every state of the union to help you with your Medicare supplement planning or Medigip, whatever you want to call it. Or take a visit with us at medicareforthelazyman.com. We would also appreciate it if you enjoy what we do. Find a place to give us a review on the book and the podcast. The numbers, they mean everything in our world, so we would really appreciate that. Last but certainly not least, thank you for joining us. You could have been 100 different places, and you weren't. You were with us spending some time with Doug Jones, the Medicare expert. But one thing that you probably didn't do is you didn't keep track of your watch. You have just spent about 32 and a half minutes with Doug Jones, the insurance guy from Oklahoma, now looking out his window to see how much snow he's going to have to scoop down there in the flatlands of Illinois.
Ugh, Arizona, take me back. Thank you for joining us, ladies and gentlemen. It's been a blast, and we'll look forward to our next visit. Bye-bye.